I'm Tommy Caranasos. I'm an assistant professor of surgery here at UNC. I direct both adult cardiac surgery and the structural heart program, what we call transcatheter valves or minimally invasive approaches for surgery. The first time that I really wanted to become a physician was that I was in undergrad and my dad was a physician. And so that first experience where I had with him when he was in his clinical role, and I went and I rounded with him one day. And I saw him teaching residents, I saw him caring with patients, saw him in his clinic. And I had this whole complete different respect and understanding of my dad that I had never had before. And I really internally was watching this happen and watching him take care of people and his patients coming up and hugging him and thanking him. That was the turning point in my life when I really thought about becoming a physician, was just that one day spent with my dad. And then after that, I started looking into it and volunteering and trying to get involved in the hospital. Thought was when I would become a general internist. My dad was an internal medicine doctor. My grandfather was a family physician. And so I always thought that that's what I would do. I never really thought about surgery. When I was in medical school and I rotated on the surgery service, tried to trade out of things, but I got on cardiac surgery. It's one of the rotations that I got. And then when I started the rotation, the very first day, I got to see a heart operation. And it was just absolutely amazing to me that someone could operate on a heart vessel that was 1 millimeter in size, that you could stop the heart and restart the heart. And I just, at the point, it still gives me chills today thinking about the first time that I saw a heart restart after it had been stopped. It was amazing to me that the heart worked better right afterwards. And so I just absolutely fell in love with the field, absolutely fell in love with the idea of surgery. I enjoyed the precision of surgery. I enjoyed the fixing of a problem with surgery. And that was really what sort of drove me on the path of becoming a surgeon. When we talk about cardiac surgery in general, it means that we're operating specifically on the heart. And that means that we operate on the valves of the heart, the muscle of the heart, the arteries of the heart, the pipes coming out of the heart, and the electrical activity of the heart. Because we're sort of like a carpenter, a plumber, and an electrician. And so each portion of the heart, mostly plumbing, is a different sort of experience surgically. And patients have problems with either their electrical activity, their plumbing, or the carpentry around the heart in and of itself. And so we sort of have to work in all three of those realms. I enjoy the process of taking care of people. So whether it's the family, the patient itself, the whole experience, we all have been through the experience of having someone that's sick, having someone having a problem that then needs to be cared for and taken through to an end. And I've had those experiences in my life with my family. And so I try to deliver care to them as though they were my family. Also, the other thing to know about me is that I usually have everybody call me Tommy instead of Dr. Caranasos, and it allows me to have that experience with my patients of where I'm not a doctor, I'm not their doctor, I'm not their surgeon. I'm part of the healing process that we're going through together to get to a fix. I think the thing that I like most about being an academic surgeon is teaching. We have residents, we're teaching the next generation of surgeons. I call being their coach. I'm not their teacher, I'm their coach. So I enjoy the process of feeling like that I have a team of individuals. That team of individuals is going to be the next leaders in the field coming along over time. And I enjoy the fact that I get to teach them how to do these operations, how to take care of patients and move forward. We have 3 beautiful children and they're 8, 6, and 3. One's a Mountaineer, one's a Gator, and one's a Tar Heel because we moved through all the time of having our kids. I have a wonderful wife and I think what I enjoy the most is that first few moments of walking in the door at home, because I am at work a lot, and to see 3 children run at you, and give you a hug is probably the best thing ever. So anything outside of the hospital that I could do as a hobby is never going to trump that feeling of coming in and being with my family and my kids.